Hello and welcome back to Politics and Polls. I'm Julian Zelizer, a professor of history and public affairs at Princeton University. This is my colleague and co-host, Sam Wong.
Hi there, Sam Wong, professor of neuroscience and founder of the Princeton Election Consortium.
During the current pandemic, Sam and I have been exploring this from a number of different perspectives, trying to get insight from different kinds of experts, from the world of healthcare to the world of politics, about what's happening, how this compares to other recent situations, and to glean a little bit more information about where this is all going. But obviously, one of the great places to look for information, for knowledge, is the past. And one moment in American history that has frequently come up in recent months as this has unfolded is the influenza pandemic in 1918, which was also devastating and raised all sorts of social, political, and economic questions as it unfolded. As I've said occasionally, it's surprising how often that has not been integral to a lot of history of the period. And as we live through this, I think it'll make many people question why when they look back. But that certainly isn't the case for our guest today, John Barry, who's a prize-winning and New York Times best-selling author, whose books have been really influential and they've won multiple awards. The book that we'll focus on today is the one that's getting a lot of discussion now, The Great Influenza, the story of the deadliest pandemic in history, which was named the 2004 book by the National Academies of Science. He's also the author of Rising Tide, the Great Mississippi Flood of 1927 and How It Changed America, which won the Francis Parkman Prize of the Society of American Historians for the year's best book in American history, and was named by the New York Public Library in 2005 as one of the best 50 best books in the preceding 50 years. He's also the author of Roger Williams and the Creation of the American Soul. He's also the author of a book that brought us together, The Ambition, the Power, the Fall of Jim Wright, True Story of Washington, which is focus of my current work and has given me the benefit of the friendship I have with John. And he's won just many awards. And one of the most distinct aspects of his work as a historian is he's really been recognized in the fields of science for his work. And he's been consulted by politicians in both parties about what to learn from this. There was a recent story in the New York Times about where social distancing came from as an idea, and I was reading it, and lo and behold, President Bush read the influenza book in 2005, I believe, and that's part of where he started to think of social distancing as a policy we needed to look at much more seriously. So anyway, John, welcome to the show.
Thanks for that elaborate and generous introduction.
Thank you, and that's just a bit of what I could say. But can I ask one kind of odd question? Why do you think President Trump keeps talking about the 1917 flu before we jump into the actual history?
Oh, geez.
Well, I've been asked that several times, and I think it encapsulates so much about him. You know, number one is ignorance. Number two is a willingness to wrap his arms around a mistake rather than admit even the tiniest one. And number three, the arrogance that he thinks he can get away with it. You know, and as you can tell, I'm not a fan.
And okay, enough said, but it's odd to...
Is there any basis to that statement? Like, is there some document someplace that said it? How could one?
Well, at this point, there are, nobody knows where the virus entered the human population. There is speculation that it could have been as early as 1914. So, and assuming it, there's a reasonable basis to suggest that it was circulating in 1917, but in terms of the actual pandemic, no. Recorded deaths or anything like that, any known outbreaks, no. zero.
So maybe we can start, just for those who don't know much about it, was the 1918 flu comparable in terms of how deadly it was and the physical effects it had? Was it like what we're experiencing today, more deadly, less deadly?
Well, there are a lot of similarities, but fortunately, this is nowhere near as lethal as 1918. That killed in a world population roughly a quarter of today's, less than a quarter, 50 to 100 million people. So you adjust for population, that would be 220 to 440 million people today. In the West, where not because of medical care, but because in developed nations, there had been other influenza viruses circulating, so there was some cross protection. In the West, the case mortality was probably 2.5%. It's much greater than that in the undeveloped world. So-called virgin populations, naive immune systems. They'd never seen an influenza virus in places like, one place where we have very good data, small, Western Samoa, but 22% of the entire population died. Forget about case mortality. We don't have good numbers in much of the world. That's why the range is so enormous, 50 to 100 million people. But the case mortality, and then it was also compressed into a fairly narrow demographic. About 2/3 of dead were 18 to 45. The peak age for death was 28, so quite different from today. But in terms of transmission, symptoms, pathology, very, 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 very similar, remarkably similar. As we keep reading more about where COVID-19 attacks the body or different organs, it just seems more and more like 1918 to me.
And one more question before I turn it to Sam, just so I understand. How much was it the actual flu and how it manifested itself versus how much was the lack of a strong public health infrastructure back in 1918 compared to what we have today?
Well, certainly if they'd taken the kind of actions we have taken, even in the United States, much less other countries where they've been much more aggressive, they could have cut the death toll. But the boss was really the virus, and so it's a combination. I won't say more aggressive public health certainly would have saved lives.
What do you mean the boss was really the virus? What do you mean by that?
Well, with nothing, they had no opportunity for a vaccine, which we do have, or therapeutic drugs, which we also are likely to develop. So there was no possible way of intervening. And I think no matter what they did, the virus would have eventually, would have been slower, but I think it would have eventually burned through essentially the entire population that it reached anyway. So the death toll might have been stretched out a lot longer. In terms of peak, it would have been a little bit lower, but not that significantly.
What was the best state of the art at that time about testing and tracking and understanding the dynamics of any of the three waves? Was there any researchers who were doing a good job of that at the time?
Well, you couldn't very well test because you didn't know what the pathogen was. They didn't even know what a virus was. They knew that there were very small organisms that passed through the smallest filters. They called them filterable viruses. But they didn't know if they were just really tiny bacteria or a different kind of organism. There was a protege, a very powerful protege of Robert Koch in Germany named Richard Pfeiffer, who thought in the 1889 pandemic, he had identified the pathogen. It still bears influenza in its name, Haemophilus influenza. So most scientists thought he was right. He had a lot of authority. He was a great scientist and inherited Koch's mantle. that obviously was not the pathogen. So people were designing vaccines against that. It was a fairly common secondary bacterial invader. A lot of people, probably most people, I would guess, died from secondary bacterial pneumonia rather than directly from the virus, although plenty died directly from the virus. And even today with antibiotics, bacterial pneumonia following influenza has about an 8% case mortality rate, quite high with the best treatment.
What about the math of amplification and spread? The idea that, you know, these days people are following this story closely, routinely throw around R naught and other terms like that in describing it. I'm really struck by the fact that people who don't have other mathematical training are willing and able to talk about these things. Was there any understanding at the time about amplification, spread? I mean, even
yeah, there was, but not in a quantitative way. In fact, there's a brilliant pioneer epidemiologist named George Soper, who was in the Army, did a lot of work that I quote in Army camps. I mean, they certainly understood things, and you know, they were trying to isolate cases. And some of the Army camps, if they would take people's temperatures, look for symptoms twice a day, and if one soldier had any symptom, he'd be isolated. If two soldiers in the same unit had a symptom, that entire unit would be quarantined. So, you know, they were quite aggressive. They understood separation. It's kind of hard to socially distance in an Army barracks and a training camp, and things like that. And there were other very good epidemiologists working at the time. Wade Frost comes to mind. I cite his work a lot. They were beginnings of quantification. They understood the concept of R naught, certainly, but they didn't use the terminology.
were they surprised by the second and third waves?
The first wave was not really a wave. It was not recognized at the time. It was hit or miss, mostly miss. You know, in retrospect, there were waves identified in New York and Chicago, for example, but Los Angeles didn't have a single influenza death. Most of the world probably got missed pretty much entirely by the first wave, and it was also mild. So there was no reason to pay attention to it. Certainly no more severe than a normal influenza season. The only thing unusual about it was that people who did die were the same younger cohort that I talked about earlier. So this, you know, Western Europe was actually hit probably harder in fact, definitely harder by the first wave than anybody else in both armies in the field. Ludendorff blamed it for the failure of his last offensive. He was trying to win the war before American soldiers arrived. Of course, there was influence on both sides, so, you know, I think he was looking for an excuse. So they were very familiar with 1889. That had come in waves. So I don't know that they would have been surprised that an influenza pandemic came in waves, but they were certainly surprised by the virulence, which they'd been given no reason to expect. The change in lethality was extraordinary, enough so that there are a minority of virologists today who think the spring and fall waves were different viruses. I think they're mistaken. I can give you a dozen reasons why I think they're wrong. I think the evidence is compelling that they were the same virus, but obviously the virus mutated. Otherwise, we wouldn't have the change in lethality.
And let's turn from the science to the lived experience of this, which we are all doing, including we all speak here. What was life like in the cities as this hit? Were people living their normal life with high death rates and sickness, or did life alter as it has now in any way because of influenza?
Well, you know, first, most of the big cities were tinderboxes. We were at war. You know, industrialization was, you know, it certainly it wasn't, hadn't, let me rephrase, war industries brought many people from the country to the cities. There wasn't housing for, where the shipyards were, big shipyards in Philadelphia, for example. The shipyards are going 24 hours a day. People are actually renting time in beds. They were sharing the beds. You'd go to work and someone would come off the shift and sleep in the same bed. That wasn't uncommon in most of the large cities where there was a lot of war industry work. So you had really a situation not entirely unlike Singapore, although it's not that bad in Singapore right now, where there's an explosion of cases among foreign workers who live in barracks. The war was good for the economy initially. Certainly everybody wanted a job, was working. The disease came. I think the number one lesson from the 1918 pandemic is to tell the truth. That certainly didn't happen, largely because we were at war. And the result of public authorities lying to the public, and I mean lying, the disease was referred to as Spanish influenza, although it did not start in Spain. But they said, this is ordinary influenza. The national public health leader said, this is ordinary influenza by another name. That was echoed practically every community in the country. And yet, the symptoms mimicked and were initially misdiagnosed as cholera, typhoid, dengue. People could bleed not only from their nose and mouth, but from their eyes and ears. Pretty horrific symptoms. They could turn so dark blue from lack of oxygen that one doctor quoted a letter to a colleague, said he had difficulty telling African-American soldiers from white soldiers because their pallor was so similar. That, of course, spread rumors of the Black Plague. And you could die in less than 24 hours. So when the public authorities are saying this is ordinary influenza by another name, and your experience is what I just described, you very quickly lose trust in anything you're being told. And society in those places began to fray and in some cases break down. So the closing orders in almost every city, but not quite every city, New York, in fact, was a singular exception, closed any place of public gathering. Church services were canceled. Schools, of course, were closed. Bars, restaurants, theaters, and so forth. But they did not go anywhere to the lengths that we have in the last couple of months. So it was really limited to places of public gathering. Nonetheless, the city streets were completely empty. And that was caused by fear, not by any closing orders or any stay-at-home orders. People were advised to avoid crowds and things like that, but they weren't told to stay home. But they did.
We're follow up. Were the effects equally, or not equally, but were they pretty pernicious in other rural parts of the country,
Yes.
outside the city, or was there?
Yes.
So it was spread.
Yeah, I was curious about that. Well, in Philadelphia, which was the city I focused on in the book, I didn't want to get redundant because it was largely the same story in every city, although Philadelphia happened to be particularly bad. Mm-hmm. In Philadelphia, there were reports of people starving, and because, there was plenty of food, but nobody had the courage to bring them food. And I was quite curious to find that in rural communities where family and sense of community was supposed to be everything, as opposed to perhaps alienation and isolation in the city. But anyway, the Red Cross reported the same kind of thing happening in parts of Kentucky, for example. where you really would have expected family to dominate. You know.
What about longer term consequences? So you've talked about fear in the immediate experience of the pandemic. How much did this affect, I've seen you write about what this might have done to cultural attitudes in the 1920s. Can you reasonably identify long-term consequences of what this did to either the United States or anywhere else?
Of course not.
Total
speculation.
Of course, but do you have an opinion on the subject?
Yeah, nothing, no hard evidence. But I think that, it's impossible to separate the war,
right,
one of the dumbest and deadliest wars in human history, from the pandemic, which also was killing young people. Certainly the war itself contributed to a sense of disappointment, disillusion, and so forth. And I think and was probably the primary cause. But I think influenza contributed to the same attitudes, maybe even more so when you get to the 20s and the idea of just partying. And yet there is a remarkable lack of literature written about it. John Dos Passos is one of my favorite writers. He got influenza on a troop ship going to Europe, which they were like floating coffins. Not many places more horrific to have the disease than a troop ship. And yet he, wrote about 2 lines about influenza in his entire body of work. I can sort of understand why historians didn't write about it much, because until Julian can confirm or deny this. But my sense from historians, until several decades ago, maybe about 30 years, roughly, historians focused only on what people did to people and not what nature did to people. I see Julian nodding, so I guess, whether it's 30 years ago or 30, for whatever, it wasn't until relatively recently that they started looking at that. So I can see why historians may have ignored it. But I don't understand why in literature there isn't more of a record.
There is a finding in neuroscience that that when you measure stress responses to different kinds of violence that befall you, if the violence befalls you from an inanimate source, it triggers less of a stressful response than if the injury comes at the hand of somebody. So if you were assaulted violently, like in a rape or other kind of violent assault, that has a large stress effect. Whereas if the injury is perceived to have arisen by chance, that is considered to be less stressful. So one could reasonably put them in different categories when thinking about them.
Well, I'm going to quote you on that from now on.
Now,
by the same token, the idea of the disease was out there. In the book, I quoted Christopher Isherwood, who wrote Berlin Stories, from which the great movie Cabaret came. And if any of your listeners or viewers haven't seen Cabaret, they absolutely should. But when the Nazis entered Berlin, he said, you could, quote, you could feel it like influenza in the bones, unquote. So he wrote that 15 years after the fact. And he expected his readers to understand it, what that feeling was like, that sense of dread.
Right.
And I think they did. When I started working on the book, I talked to my aunt, who was quite elderly. I guess she was 12 or 13 during the pandemic. And she basically grabbed her chest, remembering it, and also said it was the only time she'd seen her father cry, my grandfather. That was because a couple across the street had died, leaving 3 or 4 orphans. So it certainly registered on everybody of that generation, and other people I talked to, the same thing. They certainly remembered it and it registered. But in terms of, no way of quantifying it.
No.
And
it does.
no, go ahead.
It does seem to contradict, now that I think about it, the finding in research has to do with long-term trauma and fear. And this is interesting because this sounds like such a trauma that it contradicts what I was really trying to say, which is that somehow the trauma associated with one would be somewhat different from the other, but it seems like it was really scarring. I wanted to come back to a phrase that you used, dumb and deadly.
I shouldn't quote you.
Well, no, you can. It's like I stand by my words, but what I'm saying is that there's something about this that evidently cut really deep, and I'm just really interested in that. And it's interesting that up until last year, if you were to ask me about 1918, I would be far more likely to talk about the war in Europe than about the pandemic. So I am interested in
well, certainly in Europe, where the death toll from the war was gargantuan. I mean, the U.S. only lost 50,000 soldiers. That's, relatively insignificant. Only 50,000.
Many more from the flu.
Just in terms of actual people in the military, slightly more. But obviously, in that age bracket, hundreds of thousands.
Right.
Yeah. But in Europe, you can understand it because you're talking about millions of deaths from the war.
Right. So you used the phrase dumb and deadly, and I wanted to turn to the topic of presidential leadership. And no, we're not going to go there. So, but there are some obvious things to be said about today, but just wanted to get into the topic of presidential leadership of the past and how it doesn't seem to fall along party lines the way that maybe we might think this month it does. Woodrow Wilson, I read that you wrote that he didn't say anything about it.
Never made a public statement.
Right, which is just astounding. So was it like, did he just fail to rally the public in this particular situation?
Well, you're at Princeton, both of you.
That's why I'm asking.
Wilson, he was obsessed with the war. He would focus on something, and that was it. He was Trumpian in the sense that if you weren't 100% for him 100% of the time, if there was the tiniest bit of slippage in your support, you were in Coventry. You might as well never supported him at all. He would cut you off. And his focus was so intense on the war. He wanted no distraction, no interruption. He forged in his own words, he wanted, this isn't an exact quote or close to it, his quote would be more dramatic, but he tried to forge the nation into a white-hot weapon to throw at the Germans. No distractions. So if you understand Wilson's, dare I say, psychology, and the way he obsessed on a thing, then it's not as remarkable as it seems. There was only one thing in his mind at the time, period.
And he was a Democrat.
He was a Democrat, yeah. He also segregated the federal workforce and did a few other, basically helped launch the Ku Klux Klan.
Oh yeah, we talked about that around here. Don't worry, we know.
Yeah.
So can I ask, before our time runs out, I want to kind of fast forward a little bit. And in the introduction, I mentioned how in this New York Times article on the history of social distancing, they mentioned President Bush having read your book and how that became part of the conversation. Can you tell us just a little bit about how here, a historian and reporter, what happened that your history of 1918 entered into the Bush administration's trying to deal with the threat of pandemics?
Well, you actually have to give Tommy Thompson, his first secretary of HHS, credit. And this is before my book was published. On September 11th, 2001, he was in a meeting on pandemic influenza. He considered it so important that when he heard the towers were hit, he didn't want to leave the meeting on influenza. Although, of course, they said, wait a second, Mr. Secretary, you got to go. So, yeah, he did, but my book came out in 2004. Thompson had left by then, and Mike Levitt was the secretary, but Assistant Secretary of HHS, Stuart Simonson, read my book. And Julian, you may not realize that you met Stuart. and one of my closest friends in the world right now. He's now the WHO's representative to the UN in the US, so he's having fun right now. Anyway, Stuart read the book, knew how important the issue was, took the book to Mike Levitt. Mike Levitt also was, saw the importance of the possibility of a pandemic and the threat, and he took it to Bush. Bush read quite a bit, actually, had read Rising Tide before he was president, even wrote me a note on that. And it struck home with Bush, and he basically turned his administration around. They passed a $7.1 billion bill, which created, among other things, the national stockpile, invested in vaccine manufacturing technology, did all sorts of things, and started a pandemic preparedness planning project, which I was asked to participate in because, a lot of what, so-called non-pharmaceutical interventions, what you do when you don't have drugs, a lot of that was based on what happened in 1918. And since I knew a lot about what had happened on 1918, I got involved in that process. Not in the details of, the gritty, but in the conceptualizing of it. So I've been involved in that really for the last, since about 16 years, and work with the Obama administration as well during the 2009 pandemic. It's kind of interesting, intellectually challenging, fun, and so forth and so on. Getting arguments with modelers all the time.
And it's rare, to the audience, it's rare to have a work of history and the author becomes so integrated into policy making like that. And so that's really, it's an impressive accomplishment. And finally, you wrote an article in the New York Times. I don't know when this will air, but a few days before we recorded this, on what might come next based on what you studied with influenza. So kind of what might come next? How might this unfold? And also in the article, you have a very particular recommendation for what we need to do to try to go back to some kind of normal in the next few years. Can you tell us a little bit about the piece?
Well, it was about the question of waves. And let me not so much talk about the piece, but as we are recording this, I guess there are 68,000 deaths. If we had done nothing, we would have probably several 100,000 deaths by now and be on the way to well over 1 million, probably a couple million deaths. We have done something. We have not turned the clock back. We have not gained control of this. We have managed to create sort of a plateau. What we do in the future is going to determine what the virus does to us. How we come out of it, whether we get adequate testing and contact tracing and so forth in place. There is that the virus is going to continue to spread. But the results are, as I said a minute ago, within our control to a certain extent, even while we await a vaccine. This is not my idea. There's a broad consensus among people involved in public health. And technically, I'm actually a professor at the Tulane University School of Public Health and Tropical Medicine, although I don't teach anything. And the consensus is you need an army of workers who will both test and contact trace. Tom Frieden, the former CDC director, thinks it should be 300,000 people. I've seen other numbers of as low as 100,000. But we need that infrastructure in place to have any opportunity to do the contact tracing that is necessary to keep any kind of control over the virus. As we are taping this, there is no real sign that this is happening at the federal level. There are a couple of states that are moving forward and trying to do this, recognizing that they will have to, but it takes a while to put in place, to hire and train and so forth.
We can easily do this. We have so many people unemployed at the moment. This is like just in terms of people. Yeah, there are, and some of these people are unemployed are pretty smart people who could easily take on this challenge. It just feels like the number one thing.
Yeah, well, you know, it comes down to money, and people say, "Oh, it's expensive," but it's a hell of a lot cheaper than closing the economy down again. You know, I'm very disturbed and concerned about premature reopenings, and you know, we could easily say, you know, if we keep a lid on this, which is possible, but right now I'm not too optimistic about it, then what we would see is not so much a wave, but the way I described it in a piece, sort of an undulating swell with occasional angry whitecaps. If we don't do it right, then we're going to see a storm surge that wipes out everything that's been accomplished in a wave that will absolutely dwarf what we've experienced so far. What we started out with was a virus that was not widely disseminated through the population, and that has managed to kill 68,000 Americans and cause hundreds of thousands of cases, more than 1 million cases that we know of. It's probably a good deal. It's certainly a good deal more than that. But the virus now is widely disseminated. It's not starting from, you know, a small spot and spreading. It's already much wider, more widely disseminated. So if we let it loose now, then we are going to see a nightmare of a wave that will, you know, a tidal wave compared to what we've seen so far.
Well, I urge people to read, sorry, I'm getting a little feedback. I urge people to read the piece. And I think your idea of a public health army, which seems so obvious.
It's not my idea. I wouldn't take credit for it. You know, the dogs are barking it in the street, as they say.
But the idea that you put out there it's a tangible goal that would have such enormous consequence. And as Sam said, we're at a moment when we have people who are willing and capable of serving. I mean, this is national service in 220 and 221. I hope it gets out there, but we are out of time. And I want to thank you again, John Barry. Today we're talking about one of his books, The Great Influenza, Story of the Deadliest Pandemic in History, which is with Penguin Books, and it's out everywhere. It's selling very well again, and obviously incredibly relevant. And so thank you for having this conversation with us.
I enjoyed it, and thanks for your insights, Sam.
And,
even if you backed off them yourself.
No, I stand by it. it's just, I'm going to email you some stuff.
Yeah, I'd be very interested in that. Okay. Thanks a lot.
Once again, everyone, you can find us on iTunes, SoundCloud, Stitcher, and Spotify, or go to our website, politicspolls.princeton.edu, with great information and show archives, or the Woodrow Wilson webpage, which has all of our shows. Thanks for joining us, everyone, and we'll be back soon on Politics and Polls.
Bye, everybody.